So I like to think of a tummy tuck as both a reconstructive and cosmetic procedure. So it involves both removing the excess skin and fat from the abdomen, mostly by pulling it down and removing it. But also what happens inside is just as interesting and important, because during a tummy tuck, we will realign and tighten up the six-pack muscles of the abdomen. We will relocate the belly button or the umbilicus to its new location. And at the same time, we'll do some contouring or liposuction of the flanks, or what are commonly known as the love handles. So a lot of the patients who present to us for tummy tuck are usually the female patients who have had children and have been pregnant either once or multiple times, and now have some stretch of their abdominal skin and subcutaneous fat, as well as also some stretching of the six-pack muscles, which we will usually align during surgery. So on the day of surgery, we'll meet in the morning, we'll go over the surgical plan again and what's expected. We'll make some marks, and which is usually a good time to show the patient exactly where their incision and scars will be. And then, we'll go back to the surgery, which usually lasts about somewhere from 2.5 to 3 hours. Then we'll usually have them in an abdominal binder for their immediate post-op recovery. And usually they'll have a check by one of our team members the next day to make sure that everything's okay. And usually their first visit with me is at 1 week post-operatively. The very first thing that a tummy tuck patient will experience is what I like to call the 1,000 sit-ups. So they'll feel very tight initially, and they'll be walking a little bit hunched over because of the tightening of the muscles that we actually do inside and stretching the skin. But that is all an intentional part of the surgery, and that usually relaxes within the first couple of weeks, and then eventually they'll be more upright in their posture, and actually their posture will be even better than pre-op. Usually in the next 3 to 4 weeks, we'll gradually get them back to their activity and gym exercises and such, but we ask them to be careful because we do a lot of muscle work inside. So we ask them not to do any heavy lifting and to just do what feels right in the beginning and listen to their body.